Saving your smile. When a root canal becomes necessary. A root canal is a procedure that can save a severely damaged or infected tooth. Inside each tooth lies the dental pulp. This pulp contains nerves and blood vessels, keeping the tooth alive. When this pulp gets infected or damaged, it can cause a lot of pain. This is where a root canal comes in. There are a few reasons why you might need a root canal. One common reason is severe tooth decay. When a cavity goes deep, it can reach the pulp and cause an infection called pulpitis. Another reason is an abscess, which is a pus-filled sac that forms at the root of the tooth. Trauma to a tooth, like a fracture, can also damage the pulp and necessitate a root canal. Sometimes, a previous root canal might not have fully resolved the issue, requiring a retreatment. In all these cases, the goal of the root canal is to remove the infected or damaged pulp, clean the inside of the tooth, and seal it to prevent further infection. Inside a root canal. Understanding the procedure step by step. Many people fear the root canal procedure, but with modern dentistry, it is usually a comfortable experience. The first step is a diagnosis, where your dentist will examine your tooth and take x-rays to see the extent of the damage. Once it's determined that you need a root canal, the procedure can begin. Before anything else, your dentist will numb the area around the affected tooth with a local anesthetic. You will be awake during the procedure, but you shouldn't feel any pain, just some pressure. Once the anesthetic takes effect, the dentist will create a small opening in the crown of your tooth to access the pulp chamber and root canals. With access to the inside of the tooth, the dentist will use tiny instruments to remove the infected or damaged pulp. The canals are then carefully cleaned and shaped to prepare for filling. A special disinfecting solution is used to kill any remaining bacteria and prevent future infections. Time is of the essence. How long does a root canal take? The length of a root canal treatment can vary depending on the individual case. Factors such as the severity of the infection, the location of the tooth, and the anatomy of your root canals can all influence the treatment time. For straightforward cases, a root canal can often be completed in a single appointment, usually within an hour or two. However, if the infection is more extensive or the tooth has a complex root canal system, multiple appointments may be necessary. This allows the dentist to thoroughly clean and disinfect the tooth, ensuring the best possible outcome for your oral health. Don't be alarmed if your treatment requires more than one visit, as this is sometimes needed to achieve a successful result. After thoroughly cleaning and shaping the canals, the dentist will fill them with a biocompatible material called gutta percha. Gutta percha is a rubber-like material that seals the canals, preventing bacteria from re-entering. Finally, a temporary filling is placed to seal the opening in the crown of the tooth. Life after root canal recovery, complications, and long-term care. Following your root canal treatment, you can expect some mild discomfort and sensitivity in the treated tooth for a few days. This is normal and can be managed with over-the-counter pain relievers as recommended by your dentist. It's also important to avoid chewing on the treated tooth until you have a permanent restoration in place. In most cases, a root canal is followed by the placement of a crown, especially for molars and teeth that have undergone significant structural damage. A crown provides strength and protection to the treated tooth, ensuring its long-term functionality. Your dentist will discuss the best restoration options for your specific case. While root canal treatments are generally safe and effective, like any procedure, there are potential complications that can arise. These are relatively rare, but it's essential to be aware of them. One possibility is that the canals are not completely cleaned, which could lead to reinfection.